Another social determinant is our community. So when we think of the community, we think of our family, our friends, and just the community in general. So do we have that support from our family and friends? So when we think of the social determinants of health, we think of like where we're born, where we live, and where we grow old in. And it involves several factors. We have, for example, financial aspect. So do we have a stable income? And if we don't, that leads into other problems like our access to food. And even if we do have access to food, we think of, well, do we have healthy options available? In addition to these factors, we think of our education level. Do we have the literacy and the ability to comprehend a sheet that our doctor might give us in our clinic? In addition, we have our neighborhood. So where we grew up. Is our neighborhood safe? Do we have access to parks and recreational areas where we're able to do physical activity? We also think of just the access to our medical care. So do we have insurance, and is our provider available when we need him or her? And in addition to that, is our provider culturally competent, and is there a language barrier that we have to deal with? Another social determinant is our community. So when we think of the community, we think of our family, our friends, and just the community in general. So do we have that support from our family and friends? So all of these social determinants can affect our quality of life. There are so many ways that the social determinants affect the patient's ability to access healthcare. For example, if we think of the financial aspect, a person might actually not have insurance and or be underinsured. In addition to that, if a person is seeing a provider and they're prescribed a medication, they might not have the finances to pay for all of their medications. Other is going into the community aspect of our social determinants of health. I know that a lot of my patients have come across transportation issues. Sometimes their bus is late, and so they're late to their appointment, or sometimes a family member who was going to give them a ride isn't able to provide them a ride after all. So you think of these aspects of the social determinants of health, it goes beyond our clinic visit. It goes into the person as a whole, and the effects that all of these aspects can take a toll on their medical care. So at Emanate Health, we actually have several programs and resources for patients that don't have insurance. So I always encourage my patients that if they are facing any of these barriers, to let me know, because even if they might not be aware of these resources, me and my team are always able to work and find out these resources for you. Another avenue where I have seen a lot of barriers is if my patient might not have a space where they feel safe exercising or doing physical activity. So oftentimes I have provided my patient with local resources like the YMCA, and even just discussing different options like YouTube and finding like an exercise video that they can do at home. Just starting that conversation with your physician so that we can work together and start breaking down these barriers is one of the things that I definitely recommend for all of my patients.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.